Let's get started with the first presentation. I'll be presenting on distance and near vision impairment among government industry workers in Hyderabad, Telangana. It's a part of a larger vision and eye health in occupational groups eye survey, which are the largest study that we have done, and be presenting a small component from this. So, in 8 minutes or so, I'll be presenting on two aspects. The first 4 to 5 minutes would be on vision loss with clinical findings from the study, and then, as instructed, the next 4 minutes would be the reflections from the occupational the study. The first part, objectives of this study were to understand the burden of vision loss and also look at look at vision anomalies in these three occupations which are very much near work intensive, and then also look at work productivity due to interventions. It was a longitudinal study design conducted in Telangana. We had three occupational groups: government, factory workers, clock workers in a place called Pochampalli, and then goldsmiths. The project was undertaken in 2019 and 2023, and before during the pandemic time, we had to hold the study for some time. These are some of the representative images showing the different study procedures that were conducted as a part of the study. In total, we covered 6 factories, examined the 1361 individuals with a response rate of about 85%. Mid age was about 35 years. A quarter of the study participants were aged 40 years and older, and 87% of them are women. In total, about 7% of them had a visual impairment. As expected, the visual impairment was much higher in the older age groups, but the numbers were smaller in that age group. We divide the task in this garment industry into three different tasks: mild intensive, moderate intensive, and high intensive, depending on the work that they do. And the people in mild intense group had a higher prevalence. Overall, 93% of them had good vision. 4.04% had mild visual impairment, and about 3% had moderate visual impairment. Look at the causes. As expected, retractive errors were the leading cause of vision loss, followed by cataract and posterior segment diseases. What is interesting was the prevalence of vision loss. Visual impairment reduced from 7% to less than 1% with classes. Similarly, the near vision also, half of the population had above 40 years had near vision impairment, had reduced to 7% with vista correction. Again, as expected, odds of visual impairment were higher older age group. And similarly, we did not find any significant associations between near vision impairment and other social factors other than age. Some of the images are taken during the project period. This project data collection was undertaken immediately of the pandemic. If you see the peaceful in the next time, Mars is data collection. And again, this is a makeshift killing that was set up in each of the industries there, which is the data collection. Again, give a picture with the participants who were given classes. Even though initially there was a lot of reluctance from the management of these factories to allow us to come and do the data collection, because it's a research protocol and there are a lot of issues there. But once we started and once they realized that they are doing a visit to detailed eye examinations, the with permissions, and the people who are very resistant to view permissions have given mementos at the end of the project. Coming to the second part of my presentations, reflections from this study. First one was approvals from the employers whenever we approach a management company, because all these things are the time-driven product development companies, and they don't want to give too much of time for assessments. So that was a major challenge. And then again, the participation of the workers, because many of them are paid based on the number of pieces or pieces that they have done, number of garments that are stitched. They don't want to give the time for eye examination. So there is a likelihood that the people who paid and need, only those people are likely to participate, giving a biased response. To address this, we convinced people about the importance of health and well-being, and also its relationship with eye health. And also, we also emphasize that eye health, whatever we are doing, can be considered as one of the Welfare measures for employees. You can always take the flight. You are telling that you Prasad has come here to do examinations and all that. That has helped us. And also the limitation of time, like timeline. For example, the examination protocol is done in such a way that it takes minimum amount of time, and you get the good results. And also, we assured them that the economic data which is provided by the employers will be kept confidential. Again, to include the participation, we ensured that the results are kept confidential, and also we provided service at low cost. And also, once we had the first day when we had about 10 to 50 people examine, if you do a good job, then distribute it to cover other people for examinations. That way, we are able to get healthy response rate of 85%. Other challenge is time taken for examinations. What is the ideal examination protocol for a research study versus what is realistically feasible in these occupational groups where we are time bound? So we had to optimize the examination protocols, and most importantly, as researchers, we have a tendency to get lots and lots of data. And how many times we use all the captured data is always questionable. So we try to avoid this data obsession syndrome where we try to get too many data points. We are very clear on our objectives and characterize the data only that is relevant to our objectives. Service provision was very important to improve the update of eye examinations. We provided spectacles, near-vision glasses are provided on the spot, prescription glasses within 2 weeks, and also we had end-to-end support for service provision and referral of things. Other challenges, especially when we work with occupational groups, are the migration related challenges because in many of these occupations, people come as daily wage laborers and there could be seasonal migration. That's one thing important, especially if you're doing a longitudinal study. Absenteeism is common. Some people will be absent for 3 4 days for some reasons. And also, selection bias is very important because many times the people, the workers who feel that they need to take your classes, they need an examination, they come and we may have a poor response rate that may give biased results. So we try to get the accurate contact details, and also we have factored this in sample size calculation. Typically, when we do sample size calculation for population-based community studies, we take 10% to 50% as a non-response rate. If you do that, even for occupational studies, you are going to go wrong. You have to take about 30 to 35% as a non-response rate, and we need to figure this in our sample size calculation. To address absenteeism, again, we did 2 visits, extend the clinic by a week or so that people who are absent in the first week can get examination done later. Again, now to address selection bias, we found that even the people who consider themselves to be high normal vision should come and avail these services because it's done free of cost. There's no expenses allowed, and we take only about 40 minutes to 30 minutes for this examination. And more importantly, your employees have approved to undergo the exam. Again, when coming to the extrapolation of the results, always the occupational life studies have this bias called as healthy worker effect, especially when we extrapolate to population, because only people, healthy people are likely to be per study. The people, if, for example, severe vision loss and blindness, they are never employed or they're out of study. So you should keep this in mind because sometimes this tend to give a false impression of a lower prevalence, especially when we extrapolate to general population. And this is very inherently in all the occupational studies that we do. Again, another methodology is again identification of the lacuna in literature. We are seeing that several studies reported visual impairment in the occupational groups, but there are very few studies that look at binocular vision anomalies, look at several things like dry eye, depression, and several other things in these groups. So that way, the project was novel. Again, we optimize the study protocols, we set up a time immersion study to ensure that we complete the examination in a limited amount of time. Everybody was trained very well. We did an opus the pilot study to ensure that all the process are taken care of. Again, the outcome of the study, we get compelling results, not only the prevalence of vision loss and also very high prevalence of binocular vision anomalies. We are able to identify the service eye care needs in this population. We also developed a battery of tests that can be applied across any near vision intensive occupations. And we also assess the impact of interventions, which I did not present today. This is the last slide, and I applaud the fantastic team that I had, the Lions Clubs for the Site First Research Grant, the participants who spent the time for the examinations, and the factory management were very instrumental in allowing us to do this examination. And also, I always thank my gurus who have been instrumental in developing my career, Dr. Rao, Professor Jilkif, and David Fredman. I'm happy to take any questions that you may. And go. Are these microphones? Why? Or do I get maybe either?
Any questions, please? You. Okay. Very nice presentation. Thank you. I just had two quick questions. One is, did you also include tailors as part of the garment manufacturing people? That's one. And the second one is that you mentioned mild, moderate, and severe kind of intensity. Could you please elaborate on that?
Yeah. So garment industry includes several tasks. I mentioned the different type of tasks that includes selection of a cloth, cutting the cloth, stitching the cloth, doing quality control checks, packing. So all these are factored in. We also looked at and they are classified to mild, moderate, and intensive. For example, somebody is only packing the stuff. They're still a part of the garment company, but they're only packing the stuff, and their near vision tasks are not that great. Somebody who's really stitching the cloth or doing the quality check, they are put in the under the intensive near vision task or classified there. And the categories of vision loss are we use as regular classification. As one would expect, we did not find any people with severe visual impairment or blindness because it's occupation-based study. Because people with those vision loss automatically will get eliminated from the system. That's what we refer to as LD Parker effect.
Thank you very much. I just have last quick question. I don't know if I missed it, but you said you examined over 1,300 workers. Did you mention the response rate for the study? How many?
So, 86% was the response rate. But again, this is based on the employee list that was provided by the company and number that we examined. But again, that said, the industrial regulations that we have, we are not really sure how many of them are non-payrolls and all that. So the list that was given by the employer and the lists that we examined, that was used to calculate the response rate. We got about 85, 86% response.
Thank you. Thank you.